My guest at this time is Vitor Rocha. He is CEO of Phillips North America. Phillips North America is now partnering with the VA, the American Legion, and Veterans of Foreign Wars to make quality health care more accessible and timely to our veterans, specifically through telehealth and artificial intelligence. And Mr. Rocha, thank you so much for your time today.
Thank you, Greg. It's great to be here and celebrate with American Legion their 100th anniversary. It's great to be here.
What exactly does this new partnership entail? How will this affect veterans?
Well, we are partnering with American Legion to reach out to about a third of the 9 million veterans that are enrolled today in the VA care. As you know, veterans are, for the most part, living in rural areas, and they have difficult access to health care. So we are establishing a partnership with them in which we are deploying deployable units similar to retail clinics where we have two-way video connect and where we have support from American Legion employees helping us to have the communication with patients in rural areas. So that is allowing patients, veterans, to have access to doctors, clinicians who are hundreds of miles, sometimes thousands of miles away from where they are, allowing them to receive care and to follow up on treatment.
Phillips North America obviously is at the cutting edge of technology. The American Legion obviously is advocating on behalf of veterans. How did you two get together?
We have a long history of collaboration in partnership with the VA. We have been working with them for more than 40 years. The VA, of course, has been with the American Legion extending care at home, and we established a relationship with them in imaging, in telehealth, in connected care, and we saw an opportunity to expand access to care to the veterans, and then we started brainstorming around how can we extend that care in a way that is going to help lower the cost, improve the care to patients, and also to support the caregivers in rural areas. And then we got together, we put the pilots together, and we have now extending 10 states what we call Project Atlas, which is the deployable units that we are putting on American Legion posts in rural areas.
And explain how those will work. Is that the veterans then come to the post in order to have their telehealth conference with the doctor, or how else does it work?
That's right. Those are virtual appointments. So they come to those clinics, and they have the support from American Legion employees. And in those units, you have basic devices that provide us with the data, so doctors far away from distance can help to have access to the data of the patient and then help them to be diagnosed or help them to follow on treatment.
What's been your experience with the success of telehealth? Obviously, a face-to-face meeting with a doctor has certain advantages that you can't do remotely, such as maybe you can actually taking vitals or just being able to physically examine a patient, which you can see them via telehealth, but not necessarily examine them thoroughly. So talk about the impact telehealth can have when it's really the only option some of these veterans have.
We are a leading institution globally and in the U.S. in telehealth, not only in the private but also in the public sector. And the ability of you seeing a doctor over hundreds of miles brings benefit about the traffic, right? Not having to go through long trips to get to a hospital, to a healthcare system. It provides that ability for the patient and for the clinician to get connected to a two-video wave connection. And if a patient has a hyperglycemia, hypoglucose, it provides the doctor the ability to see the data and then intervene, provide consultation, and then help the patient to take the right medicine at the right time.
How is artificial intelligence part of this cooperation?
In many ways, we're applying AI in predictive analytics. So we have a solution called Early Warning Score, that we use today in the hospital world and basically provides a very early score for clinicians before the patient health deteriorates. So in other words, if you have a patient in an ICU bed and this patient is being monitored, the AI and the predictive analytics builds information and early warning scores, allowing clinicians to get to the patient much earlier than today a doctor gets. And that helps to prevent and helps also to lower the cost of medicine.
Remind us what you said in the beginning about the extent of your involvement here. How many states, how many different localities will this affect, and what are your goals moving forward a few years from now?
For now, it's just a pilot, so we are excited to have this partnership with American Legion and the VA to have those pilots in 10 states in U.S. We're going to collect the data and see the results of the data, and then from there, we'll discuss with the American Legion and the VA on how we can expand that to other states. We're going to go on a phased approach. It's going to depend on the results, and then we'll take a decision about expanding that to other states.
What will you be looking for in the data to determine what kind of results you've come up with here?
Patient outcomes. We're going to be looking at patient satisfaction. We know as a fact that there is a high satisfaction from veterans about using telehealth solutions. We wanted to see that being replicated with our model. We're going to be looking at that kind of data for us to take a decision on expanding the pilots to other states. How
excited is the VA? Obviously, there's been a lot of attention in the last several years about wait times for veterans. Now that these folks, at least in some areas and hopefully more areas as the years go on, will have access to this sort of consultation through telehealth and artificial intelligence, how much of a difference do they hope this can make over the years?
The VA is very excited because they want to reach out to the patients in rural areas. And we know as a fact through our healthcare key future index that Americans are reluctant to go to appointments, to go to 58% of the Americans are reluctant to go to hospital appointments. So by having technology such as telehealth, the VA is going to help to expand the care in rural areas and then lower the cost of medicine and improve outcomes. And they are very excited about using our technology, but you cannot solve that with one partner only. It requires multiple partnerships to achieve that, and that's why we're excited to have American Legion helping us as well.
And how can folks find out, veterans in particular, find out if this pilot program is available where they live?
We are using the American Legion as a way to communicate with veterans, but the VA is also supporting us in the communication, and that's how we are getting the word out.
So the American Legion is the way that veterans can find out if it'll be available to them in the near term here, or whether they'll need to wait for the plan, hopefully, to expand if the results are what you're hoping for. Mr. Rocha, I know a lot of folks are excited about this. They've been frustrated about the wait times, and anything that can help those who have sacrificed so much for our country is very, very welcome. Thank you so much for what you're doing, and thank you for your time today.
Thank you, Greg. Appreciate it as well.
Vitor Rocha is CEO of Phillips North America. I'm Greg Columbus reporting for Radio America.